All right, we're live here. Welcome, everybody. We're so glad to have you and welcome, everybody. We're so happy to have you here and glad to be speaking to you today about men's health. We've got a great panel to round things out a little bit here. I'm going to have them introduce themselves. I'm Dr. Mark Loafman. I chair family and community medicine here at Cook County Health. I'd like to introduce my panel. Dr. Baltazar, are you able to tell us about yourself? Yeah, I think we're having some mic issues. Dr. Turner?
Good afternoon, everyone. I'm Dr. Arnold Turner, executive of Providence Hospital of Cook County. I'm also the medical director. By training, I'm an internist and I practice here as a primary care physician. So looking forward to this discussion with some of my colleagues and friends and peers about men's health this afternoon.
Thank you, Dr. Turner. Glad to have you on board. Dr. Stroy.
Well, hello, and thank you for having me, Dr. Loafman, Dr. Turner, Dr. Baltazar. It's an honor to be here. My name is Dr. Florian Stroy. I'm a board-certified urologist. I've been in the Chicago area for most of my life, and it's an honor to have the opportunity to give back to our communities and our patients.
Wonderful. Great to have you on board too. And we recognize that with technology, some of you are struggling a little bit. We know some of our guests are too, and that's we're going to blaze ahead. But if you need to log out and come back in to make sure mic's working, we're going to understand that and get going. Dr. Balsar, have you been able to get your speaker working to hear us yet? If not, don't think so. So feel free to log out and come back in again so we can get you back in the chat too. Yeah, thanks so much. So we want to start talking a little bit about, it would not surprise anybody to talk about men's health and kick off with prostate cancer screening. And that's, of course, such a big topic. And there's been a lot of change recently in terms of age and when should we start. We've come from kind of an area, Dr. Turner, I know you deal with this with your patients, when we should start screening and kind of the shared decision-making concepts that we used to have. And so we've kind of moved a little bit more. Shared decision-making is always important. Patients always have autonomy over what they do. But I think we've kind of gotten a little stronger about our recommendations and a little bit more encouraging and driving some of that a little bit. So Dr. Stroy, if you're able to, and then I want to hear from Dr. Turner too, when should men bring it up if it isn't coming up? I think it's probably coming up in visits too, but when do you think men should bring it up? And Dr. Turner, can you help us with that? When do you want men to start talking about this in practice? Dr. Turner?
Yeah, I think men should start bringing it up when they're approaching the middle years of life, start crossing age 40. Because then we start, want to say it or not, we start noticing some changes at that point in our life.
Right.
I know I did. So we need to start paying more attention to our health and what we're doing to maintain our health. And that's when a lot of other screenings start kicking in. So around the same time, we should start thinking about prostate health.
Right. Yeah, no, thank you for
whether we're
that.
noticing symptoms or not, we should start thinking about that. I think among African-American men, it's pretty prevalent that most men know someone or has someone in the family that has prostate cancer. So it's not that it's not known, it's whether or not, when should you start screening for it? When should a man start screening? And bringing up that question.
Yeah, no, thanks so much for that. And Dr. Stroy, you spend a lot of time each day talking about this with your patients, so in your field. And so anything you would say differently or add or reinforce Dr. Turner's message?
No, I do, Dr. Loafman. Without having been able to hear Dr. Turner, the way I kind of approach this conversation is, I think for most men, especially in our community here at Cook County Health, I really start thinking about it for most men around the ages of 45 to 50. And look, we're not necessarily talking about an automatic test that every man needs, but we're really having the conversation and we're having an informed discussion between you as the patient and your provider. And we know men at higher risk, including Black men, and men with a father, men with a brother, or men with multiple relatives who are affected by prostate cancer, we know that those men should begin that conversation between 40 and 45. So, Dr. Loafman, family history in my mind tells me, hey, we got to move the clock forward a little bit for this gentleman. And the goal is not to test every man the same way. It's to find the right time for the right man. And I think that here at Cook County Health, folks and patients in our communities benefit from that personalized care, where we take.
You're right. No, you froze up there a little bit, but the
And
personalized care.
how do we move that forward?
Yes. No, that's great. And I really appreciate that perspective. And I think, obviously we get into the PSA blood test that's so much talked about today and people concerned about it. And we all know we were a little concerned about doing it too soon and getting people involved in care that they were never going to be affected by. They were going to live out their life and die at a ripe old age or something and never be bothered by their prostate. And we didn't want to bother them with it. But we're now realizing, the test by itself doesn't drive anything. It just drives thinking and awareness, and it gives us some options. So, how about the PSA test? Should people be afraid of that, or is it something we welcome? And how do we deal with that data when we get it?
We certainly welcome that within the urologic community. The PSA test is a very very effective blood test, probably one of the most effective sort of screening tests, blood tests that we have for cancer. And so let's take a step back. What is it? Well, we know it's a small protein made by the prostate, and it really just measures how much of that protein is circulating in your bloodstream. Now, what does it not mean? It doesn't automatically mean cancer if that PSA blood test is high. No. It can be elevated because you might have a large prostate. You might have some inflammation or an infection of your urinary tract. You may have had recent ejaculation. If you had sexual intercourse the night before, we know that sometimes that can help inch that blood test higher. And so I tell patients, look, if you were to leave anything from today, is think of the PSA as a smoke alarm, certainly not the fire report. And it's a signal that deserves some confirmation, certainly some context. And sometimes, yes, we do need to do further testing, but certainly nothing to panic or worry about. And I tell all men, hey, know your numbers, know your PSA, engage with your provider and discuss what those numbers mean to you.
I really like that. And I think, my own practice has changed. I'm much more encouraging of let's get the number and then have a thoughtful conversation about it. And to your point, if it's a mild elevation, let's really think about, should we repeat it? Should we check again? Or there are factors that might affect it and it's actually normal and we're fine? Or, when might a biopsy or something be in order? And I think, because this is a slow growing cancer and we have some time, it's helpful in a way to get information early and just be cautious. There are, some production pressure on sometimes for people to do something. We're scared, but you may have cancer. Let's start doing testing and treatment. But it's great to know that we have time and we can think through that. And I think we're super encouraged by the trend of earlier diagnosis when we can treat people who do have that. So thank you for that. And speaking of just prostate health in general, there are other warning signs. I mean, prostates grow with age and symptoms start to develop. So how do you kind of coach and counsel folks to be aware of when might they need to, regardless of the cancer screening question itself, which is when might they need to bring up concerns about prostate health with their doctor?
Absolutely. Dr. Loafman, and I see and hear about this every single day. And the most important truth here for all listening is that, look, early prostate cancer usually doesn't cause any symptoms. I just gave the unfortunate news of 30 minutes before this, where we diagnosed a gentleman with a high-risk prostate cancer who didn't have any symptoms.
Yeah.
But and that's why we talk about screening, and appropriate screening matters, and having a health system that's engaged on multiple levels with their primary care doctors, with their specialists and their surgeons, and everybody in between, who can all be on the same sort of page and engage the community and perform appropriate screening. For guys, I'd say, hey, look, if you have any new or worsening urinary complaints like you have a slow flow, you have a hard time emptying your bladder, you're waking up at night multiple times to urinate, or even during the day, or you have a hard time holding your urine. Sometimes folks, we see blood in the urine. Look, most of these symptoms are not cancer, but they importantly should not be dismissed as getting older or something that it'll go away. No, those are signs that you should talk to someone.
No, it's super helpful to separate out kind of the age-related normal progression of a prostate that gets bigger and starts to cause urinary symptoms with cancer screening. They're related, but they're really two separate topics, and they both deserve attention in and of themselves. So I really appreciate that. Thanks a lot. I'm going to switch gears a little bit too. I know we only have so much time, and I think there's a couple of other big topics. I want to touch on heart disease. It still remains the leading killer for men. And Dr. Turner, the top 3 lifestyle changes. I know for sure. I see patients along with you. You talk about this with your patients in practice, and the kind of top 3 things that we can do. It is the leading killer of men, but it doesn't have to be. A lot of it is preventable and avoidable. So, what should we be thinking about for that for the men in our practice?
Speaking of lifestyle changes, usually I start off when I'm talking to my patients about diet. We are what we eat, in so many words. Example, like if you have a car that requires premium fuel, it will run on regular, but it won't run as long. So it's important that just like a car, that we take in the appropriate fuel. And also in that conversation, have a lot of people conversation about why we exactly eat, so they understand the importance of that, because most people don't think about that. We eat for several reasons. One, provide an energy source for our bodies, and that's what what we eat is turned into glucose, which is the fuel for the body. Two, we eat to provide the body those things that it can't produce on its own. Those are amino acids, essential fats, minerals, vitamins that are essential for the body's function. And the third reason we eat is to buffer the acid in the stomach that is normally acidic.
Yeah.
So when we eat, the food actually buffers that. So those are the reasons we actually eat, not to satisfy our appetite so much. That's a sign to us that it's time to eat, but not just to satisfy that, get rid of that feeling, but to provide the body what it needs. So diet is very important. The next one, I actually link 2 of these together, is that maintain the proper body weight and exercise.
Yeah.
I link those together because body weight, one of the ways to maintain the proper body weight is to have regular exercise. And in that conversation, I tell the patient, the man, that you should choose some activity that you're going to do and stick with. I can swim, but I guarantee you, I will not go swim laps for anybody for exercise. That's not going to happen.
Right.
Run, I'll do other things, but I'm not going to swim laps. So it should be some.
Yeah, there's activities that we can all get behind and do. So I like that, and not setting the bar so high, setting these unrealistic goals, right? So,
right.
And I love the way you approach the diet emphasis. I think, and this comes up so much. You can spend a fortune on supplements that are going to boost your whatever, and there's without any evidence that it's helpful. But we know that same money could buy some tasty fruits and vegetables and grains and greens and all the good stuff for us, and that we know helps. So evidence says put your money at a good grocery store and food products, and work on your diet. So much of our heart health is really driven by that. So that's super helpful information. We could talk a lot more about that too, but I think we get back a little bit to the men's sexual reproductive health again too. But there's a lot in the press about testosterone, about low T, and who needs it and who gets it. Patients are asking for the test, and they want the supplements they're seeing on TV. It's very attractive, and it seems that it will be easy. Pop a pill and get my manhood back, right? So, Dr. Troy, how do you approach that conversation when it comes up, and how would you guide us in the primary care world to think about testosterone and dealing with it and navigating this very heavily marketed industry right now around testosterone?
I think you're right, Dr. Loafman, because it sounds so easy and folks are real excited about some of these opportunities. that I think sometimes we get a little bit too ahead of ourselves.
Yeah.
And when we talk about low testosterone, we're not talking about a number. The numbers are important, but we need to take a look. Hey, are there any symptoms involved with this? You need to take a look at a true testosterone deficiency requires symptoms to be associated with this. And what are those? Well, low libido, fewer morning time erections, a loss of muscle, fatigue, poor sleep, reduced bone density. Look, when a patient comes into our clinic with repeatedly low early morning testosterone levels, generally we'd like at least two tests to demonstrate these findings. The cause must be then evaluated thoroughly by a medical provider before treatment even begins. And so, my thought here is we got to treat the man, not the marketing behind it. And it's certainly not a single number on a laboratory report. A thorough, purposeful evaluation needs to take place. And if it's indicated, then we have that conversation with the patient and say, hey, look, this is what therapy looks like. These are some of the side effects that might take place, and this is what we watch you for. But we do so in a very systematic, purposeful evaluation and management of that.
Very good. Yeah. I don't know anything to add, Dr. Turner. Comes up certainly in your practice too, but yeah.
Yep. Even with some of those symptoms alone, it deserves an evaluation. Because feeling tired, low energy can also be caused by certain medical conditions like an underactive thyroid, hypothyroidism,
Yeah.
the conditions that have not been diagnosed yet. So the body can only respond in so many ways. So there's a lot of the same symptoms for multiple reasons. It needs to be dissected out, determine exactly
Yeah.
what causes appropriate treatment.
No, I think that's great. And, one of the other causes of low function can be depression. And, it's something that, stigma around that. And men, we know sometimes have trouble thinking about mental health, and I'm going to tough it up and it's not going to affect me, but we know statistically it does. And it's sometimes not something people want to hear about. So, we really wanted to think about that. And I know in my own practice, I really try to ease that in and normalize that. Not that it's okay to have it, but it's common to have it, and it's not your fault. It's not a weakness, right? So I think that whole messaging that having a mental health condition, it's really kind of a neurobiochemical understanding of how our brain functions and how we feel. And so we want to get away from the shame and stigma. Because and I know we don't want to try to be treating a condition medically that really is it's a mental health condition. We consider it medical still, but the treatment's a little different, right? And so and how do you when you both are facing that in your practice, Dr. Story, it comes up to you. I'm sure there's times when someone seeing you thinking it's a medical problem that's reproductive related, and you can tell this is probably depression, and guiding them back. How do you approach that? And then I'll ask Dr. Turner the same thing.
I do see that quite a lot, as I'm sure all of you, physicians here on this platform do as well. And, I think particularly in the communities that we treat, particularly communities of color, men have historically and traditionally learned that, hey, toughness means you have to carry everything silently. But I think, in these situations, silence is not strength. It's really what's destroying you from the inside. So you have to learn to ask for help. That's not surrender. That's strategy, and it's moving forward. Start with one trusted person that you can talk to. Oftentimes, your primary care physician.
Yeah.
Oftentimes, your urologist, or somebody that you might know that can connect you and engage you back into the health system. A mental health professional, certainly. I was just on a podcast about this a few weeks ago. Mental health care is healthcare. It's the very backbone of what everything else is built upon. And really, no man, no woman should have to prove his or her strength by suffering alone. And so it really begins by having the conversation, having the courage to speak up, and understand that, I think here that at Cook County Health in the heart of Chicago, you benefit from professionals who do this day in and day out, who
Yes.
treat you with compassion and with care, and importantly, with dignity.
Yeah, and I think we respect it when people are willing to confront it and bring it up, right? And I know I often explain it, if you're playing golf and you keep hooking that drive it and you want to help, you have no shame getting a coach, right? And be proud of it. Hey, I got some coaching and look what I've done. Or the home improvement project that went south, and you're going to get a pro in to help you. And I think this is really the same. It's having the courage to admit that I want some coaching and help. And I think we all think of therapy and mental health treatment now much more coaching than treating a sick, weak person, right? That's not the right answer. So, Dr. Turner, anything to add? I know you approach this in your practice regularly.
Yes, one of the things Dr. Story touched on is, to admit that you have a problem, it's not a sign of weakness.
Yes.
Convey it to the patient, it's actually a sign of strength. That if you're able to recognize something yourself that needs to be addressed, that's actually that's a stronger person than somebody that's just going making it through life. That's when you actually get help. The other thing I think primary care physicians are in a unique position because we're seeing patients more frequently, so we kind of get to know them and we
Right.
can pick up on things and how they're saying them. Usually, when I first go in the room, I ask the patient, "What have you done? What have you been doing since the last time you saw it?"
Yeah.
Let's start a little brief conversation to
Catch
see
up a
how
little bit. Yeah.
just to check up on it.
The last visit and see what's going on. And yeah.
Going on. I've been doing someone who's normally active. Now they can stay hanging out in the house. That's still a sign of something. Huh. Other thing you have to when I pick up on stuff like that, have a conversation. Uh, Mine is just like it covers the whole body. So when you have a problem that affects your right arm, you have symptoms in your right arm. If you have a problem that affects your leg, you have brain that affects your leg. But brain also covers our emotions and our ability to think. So those areas involved have made angry,
Yeah.
sad. Those are all governed by chemical reactions. Right. Try to take it away from it being
That's right.
sign of patient
We
going
look
on.
at it more the same, don't we? We don't
Right.
look at mental health as something different. It's just another part of the medical continuum, and we want to treat it accordingly. And I think we respect men who are willing to do that, and we look at them with pride. And so, and then, and if they can come back and be a better partner for their loved one and their family, and better able to perform at work. I mean, that's again, it's coaching for success. So I'm going to wrap us up a little bit. This is a great conversation. I know we've had some technical difficulties. That's not your fault. I appreciate your patience during that. But I think for our audience, we really touched them. And we're just going to wrap up a little bit by, if you're watching and you want to turn your health around or be important, we have this concept getting up to date, be up to date. Check in with your primary care doc. And am I up to date? Am I doing the things I should do based on my age and based on my condition, based on my family history, as Dr. Story said. So I think that's what we want. And just like you're going to keep your car and your homeowners and everything else up to date to do preventive maintenance and not have to deal with problems. That's really true. It's a huge opportunity we have now. Our medical record, we organize this, we sort it, we're using the best age statistics and demographics we can do to keep you up to date. You deserve that. Your family needs you to do that. And so please take away the lesson here that engage in healthcare, know your health, know your numbers, as we said, understand where you are and make sure you're up to date. Don't tough it out and die young or suffer sooner than you need to because you're being a tough guy. We really don't want that, and we're not looking for that. So I'm going to wind us up and wrap us up there. Any other closing comments, Dr. Story? Anything else from you that you would add?
No, it's been a privilege being with you all here today, and I think you said it beautifully, Dr. Loafman. Knowing your numbers, being engaged with the health system.
Yeah.
We really have gotten, as a medical community, have gotten so much more nuanced, and more advanced than ever. And we have quite a lot of tests and studies at our disposal that we can use to really make it easier for our patients. And to really keep you up to date, as you mentioned. So, I encourage you to please go see your provider and your doctor.
Don't be afraid of us, right? Come on
That's
in.
right.
We welcome you. Yeah. Dr. Turner, anything else?
Yeah, with all the advances in medicine, medicine is really focused on early detection and prevention. A lot
Right.
of prevention and chronic disease management so that you can live longer. So if you're outside the healthcare system, you can't take advantage of these things. The key thing, message I want to get across that if you don't have a primary care physician, you should take time to have one. And that's, and when I say take time, you should try to have a bonding relationship, someone you can relate to that you feel comfortable with. I'm a primary care physician, and I have a primary care physician
Yep.
that I see on a periodic basis just to keep myself in check. I know what I'm looking for in all the other patients, but I want to make sure I'm still around here too, and have fun with my family and my new grandson too. So,
And I bet you're up to date, right?
Yep.
You've got your vaccines, you've got your screening tests done, and I know
everything.
you, and I know you are, and I am too, and I'm sure Dr. Stroy is, and it's good enough for us. It's good enough for everybody. So come on in, get checked up, and stay up to date. Thank you all. We appreciate you being here. Again, sorry for the technical difficulties. We'll come back at you with a follow-up. So thanks a lot.
Thank you.
Bye-bye.
Bye. Have a good afternoon.
Bye, guys.
Bye-bye.